Okay, we're live. Hello, everybody.
Hello.
Let's wait for a few people to join.
Oh.
Oops. There you go. Hello. Hi, Lily. Hi, Pamela. Hi, Olga. Hi, everybody. So today we have a special guest.
Hello, everybody.
And it's gonna be me and Mike. Now we're gonna do the introductions, but in today's live, it's a little bit different than usual. We're still gonna cover all your questions, but today is gonna be about our clinical studies, and that's why we have Mike here, which is our expert. And if you guys have any questions, as usual, please feel free to drop them in the comment section, and we'll do our best to answer to all your doubts. But yeah, hi Kino. Today we are gonna be live on TikTok and on Instagram. So feel free to use the chat and text us, send us a message and a comment if you have any questions. It's Mike, yay! Yes,
It's me.
Today we have Mike. Alrighty, so we're here to talk about our clinical studies. You guys know me already. I'm Kiara. I'm here with CEFALY. Why don't you introduce yourself since they haven't seen your face yet?
That's true. You may have seen me in the chat sometimes putting emojis in there, but my name is Mike. I'm technically an inside sales representative, but I deal with a lot of patient education. Thus far I'm covering the clinical trials today. I've been with CEFALY about 9 months now, so it's been a great 9 months, and I'm happy to share my knowledge with you guys.
Yay! Thank you, Mike, for joining today. I feel like your insights are going to be inspirational for all the people that have CEFALY and for the people that are still thinking about getting one. Hi, Dolores! Alrighty, so today I have a special package. Where is it? Okay. I'm going to show you a different one because our special Lily here, she provided us with a brand new package from the VA. This is what our veterans get when they order a CEFALY device, and it's cute, so I wanted to show it to you guys and speak about what CEFALY is, which is the reason why we're here. So CEFALY is a migraine treatment, is a non-invasive migraine treatment worn on your forehead. It stimulates and desensitizes that trigeminal nerve. This is our newest CEFALY Connected right here. And today we also have our CEFALY Enhanced available in Europe and also in UK with our distributors. So today we have these two. And what the device does is has two modes. Has the acute treatment, which is a 60-minute treatment for when you're having a migraine attack, and has the acute treatment, which is a 20 minutes treatment for prevention. So should we show it how to use it?
Yeah.
All right, so we have already opened it, but when you guys get your device, in the little pouch over here, you will find the device and then the charger with the little deck over here, and then the electrodes. The electrodes are the ones that are gonna help you stick your device and keep it on your forehead, which, by the way, we recommend laying down and do your treatment while laying down. So, Mike, here, you can use the enhanced.
Nice,
So our community in Europe doesn't feel like, we don't think about them. But, there you go.
Nice.
Okay, so,
Thank you.
you're welcome. This is the electrode, and we recommend washing your face and your hands before each use. Do not use any moisturizer, don't use alcohol pads, don't use anything but soap and water. Then you can finish your skincare routine after you do your treatment. So we recommend peeling the electrode really slowly And then you want to place it right above your eyebrows, right here. How many times can you use the electrode? All right, it varies according to each person. We have testimonials of people that have used the electrodes about 10 times, 12 times. It can be more, it can be less. What matters is that if you use if you wash your face and your hands before each use, and you don't use moisturizer or serums nor anything but soap and water, that will help the electrode last longer. And make sure you lay down. So you really want to take your time here and make sure that the electrode is well attached, and then you can finally put your device on. Now, for demonstration purposes, I'm just standing right here, but ideally you want to lay down and do your treatment while you're laying down. A lot of people like to do it on the couch or a comfy chair, something that helps you, keep your head tilted back. So remember these two colors, turquoise for acute and purple for preventative. Should I do the acute and you do the preventative, or vice versa?
I'll do the preventative.
Okay, cool. Alrighty, so you press 1 time for acute, twice for preventative, like mine did. Let me do it again. I'll do the acute first. 1 time for acute, and that's it. And then, if you want to do the preventative, Mike, you want to do it again?
So you're going to press it once, and then you're going to wait about 2 seconds, 1 Mississippi, 2 Mississippi, and then you press it again. Obviously, I took too long there because I was explaining, but 1, 2.
There you go.
And then you get that color. A good way to remember it is if it's an acute, it's an aqua color, so AA, and if it's preventative, it's purple, so PPAA.
So one thing you guys need to know is that the intensity is gonna ramp up, okay? You don't, especially if you had the device for like you're a newbie basically, it's important that you really stabilize your intensity to understand when it feels good. You really want to make the treatment should be comfortable for you. It's like a therapeutic treatment, so you don't want to have pain. And the way you stabilize the intensity is you press 1 time to start the treatment, and then let's say after a few minutes you feel like you feel this tingly sensation on your forehead and you're ready to stabilize it. You just press and you will hear like a little beep, and that's how you know that you stabilize the intensity. If you want to go higher in the intensity, you keep pressing, and the intensity will go higher. If it feels too uncomfortable for you and you're like, no, this intensity is too high for me, just take it off and then start the treatment again. Okay? We have a few questions. I can't wait to try this. Thank you so much. We can't wait for you to try it. And once you get your device, make sure you schedule a CEFALY coach call. So one of our customer service representative can teach you everything about the device. And the way you schedule the coach call is very easy. You go on our website and you click on Getting Started and then CEFALY Coach. We also have another question. When are you going to be selling the Connected in the UK? I currently have the CEFALY Dual and I'd like to upgrade, but I love the idea that the Connected will track your migraine attacks. Okay, so first of all, I hear you, and hopefully soon, fingers crossed, but we will transfer this to the appropriate department. So, we pressure them a little bit more. And then for what concerns the Connected, great point. One of the features of CEFALY Connected and one of the differences in between the CEFALY Connected and the CEFALY Enhanced is the Bluetooth capability. So our CEFALY Connected connects to the app CC. So you can track your migraine attacks, you can track your not only your treatment, but you can also stabilize the intensity because you understand what your sweet spot is. So it's gonna have a chart where it shows you like the intensity of the treatment, and you can log the treatments, you can download them to bring into your doctor, and yeah.
And pairing, it's very easy. As soon as you open the app, it's going to ask for a serial code. Just have to look on the back. There's a really tiny number here. You just put that in and it should sync with no problems.
So yeah. Now, I'm going to remove the electrode. Very important that you put it back. It's very important that you guys put it back on the little plastic. And then back in the pouch. And then you seal it. A lot of people like to save it in the fridge, to store it in the fridge. So that's a good way, to store it. You just shipped the connected to the UK directly from the States. No, unfortunately, we do not. We don't ship directly from the US to the UK right now. Can I get it on Amazon? Yes, we are available on Amazon. Okay, but if you buy it from our website, you can use code TikTok10 for a little discount, a code that you cannot use on Amazon. So if you buy from our website, you can use TikTok10. Otherwise, we are available on Amazon as well. CEFALY is absolutely fantastic, and it has made such a huge difference in my quality of life. That's why I'm desperate to try the Connected. Stay tuned. Make sure you follow us on social media, because that's where we do all the big communications. And yeah. All right then. Should we dive deep into our clinical studies now?
Yeah, let's do it.
Yay.
So I'm gonna over-explain. So if anyone has any questions, just feel free to fire ahead, and I'll explain as best as I can. So I'm going to do this chronologically. We had our first study, which was called the PREMICE Study. So as you guys know, there's two modalities to the device. There's the preventative and the acute treatment. The first clinical study that we did was with the preventative treatment, which we call the PREMICE Study. And what we wanted to do here was basically test the efficacy, or how well it worked for the preventative treatment. So what we would do is we took a 30-day baseline at the beginning, and then for 3 months or 90 days, we had the patients have one preventative session every day. And at the end of it, we wanted to track basically the change in their monthly migraine days. They use the preventative every day. So what do we see? After the 3 months, we actually saw that there's a 25% reduction in overall migraine days. I think the best statistic, though, and especially maybe for you guys, is I know myself, CEFALY is great for me because it's an alternative to medication within the responder group of our test that we did, which means basically all the patients that had a 50% or greater improvement in their migraine days, which in this case is a reduction in migraine days, they actually use 75% less acute medication use. So those 3 out of 4 people who use CEFALY, it was a viable replacement for any medication that they took. And that's huge. I think a lot of you guys, myself included, CEFALY, that's the big selling point, is it's not medication. You can control your own treatment. So that's huge. That's awesome. In addition to that, we also wanted to find the change in migraine attacks, all those kind of things. We saw a 20% decrease in that. And as far as the acute drug intake, as far as everyone, there was almost a 40% reduction just across the board in taking medication. So for those of you who are wondering if CEFALY can maybe, replace medication, it can. We have clinical studies to back it up. But also for those of you who want to add it to your migraine toolbox, that's completely viable as well. Okay, so moving on a couple of years now down the timeline, we have the ACME study, which was an acute study. The final two I'm going to talk about are both acute studies. So the ACME, basically what we did is we had our patients come into a clinical setting and try out the acute treatment. And after 1 hour, we saw a reduction of almost 60% in their pain score. So they would write down the score, a scale of 1 to 11, and the scores were 60% lower after the end of the session. So obviously that's a great number. If you had a 9 or a 10 on your migraine, it was killing you, you know, it probably got to a level where you could function day to day, go through your normal activities, and that type of thing. Also, we saw a large reduction in pain medication, again, in this study. I'm going to keep saying that. That's a huge thing for us, is that we are, you know, potent enough to be able to replace that medication if that's something you guys perhaps are skeptical about. So ACME study was another acute study where we had great results.
Mattia. Hi guys, do you ship to Italy? We have a distributor in Italy.
Okay, so the next study that we did, and this was our latest study and our largest study, it had almost 540 patients done in this study, so very large. Another acute study, except this time we had the patients take the device home with them. So this is good because it shows that we can use, or the patients in this test can use the device independent of a clinician, a physician, what have you. So, you know, the device is not, you don't have to be a rocket scientist to use it, essentially. Great thing about this test is that we looked into the pain freedom. Pain freedom is great because it's objective. You know, your pain score on a scale of 1 to 10, everyone has a different pain tolerance. So that can mean completely different things for different people. So we saw almost 27% of our patients had pain freedom. So no pain whatsoever from their migraine attack after 2 hours of use. And if you guys didn't know, the acute session is typically an hour. However, if you feel the need, you can repeat that for another hour, up to 2 hours total. So that's what we did in this session. We also saw that the resolution of the most bothersome symptom, which for some people may be sensitivity to light, also known as photosensitivity or photophobia. And we saw, a 57% reduction in the most bothersome symptom. So that's huge. Over half of everyone who tried it in this test, their most bothersome symptom was relieved. For example, say for you it's light. I know a lot of people have light sensitivity. Can't go to the supermarket, can't go to the gym. It makes a lot of things harder in your day-to-day life. So for over half of our patients to be able to see that, I think that's very robust data. It just speaks to the power and the, what CEFALY can do for you. So I don't want to get too crazy into this. I'll take a break here if you guys have any questions for me or Kiara, just fire away.
We have 2 questions. I have one question. Can you please send the contact link to purchase in private? Yes, send us a message in DM and I will send you the link. And also, we have a question on TikTok. Well, it's more a comment. 2 hours total. I use mine for hours. Great point. So we recommend you can actually use the acute treatment for 2 hours, so 2 treatments back to back. Then we recommend waiting for at least an hour and a half, and then you can do more treatments. But one of the questions that we always get is, can I use my preventative treatment even if I use the acute treatment today? And the answer is yes. The 2 treatments run at different hertz. So they're actually 2 separate treatments. So to make a long story short, yes, if you're doing your acute treatment today, make sure you still do your preventative treatment.
Yep. And I'm just going to add the preventative treatment. The way I like to think of it, it's like a migraine muscle. So at first, without CEFALY, your migraine muscle is weak. So it's very easy to start a migraine. The onset of a migraine starts very easily. However, with a preventative session, it's kind of like hitting the gym. You get stronger and stronger, and it takes more for the migraine actually to occur. To the use of the preventative. You're not going to see a night and day difference over the span of a week, but if you build up that tolerance over time and you're consistent with it, we have, as I've explained, some great numbers to back it up. So absolutely do your preventative every day, and if you still have a terrible migraine, then you could also implement the acute.
Do you guys have any questions about that regarding the acute or preventative? I am 65. Can I use CEFALY? Maybe we should talk about our little side effects a little bit more. Yeah.
Absolutely. So we are indicated from ages 18 to 65. That doesn't mean it's, very dangerous to use it outside of that span. That's just what our indication is for. If you're outside of that range, just ask your doctor, and they can help you with that. As far as adverse events, everything that we have is fully reversible within 24 hours. So, everything I'm going to say, not too, dangerous in the grand scheme of things. However, the most prominent thing is a sedative effect. So a lot of you guys who use your CEFALY probably notice that you get a little bit tired. And that is the number one or one of the top reported events. I've spoken anecdotally to a lot of people, and they say this is a great thing because if you have a migraine, you're already laying down and you kind of just want to relax anyway. So to have that sedative effect can be very great for some people. Just make sure you don't use it while you're driving, operating machinery, anything of that nature. Don't use it in the shower, while you're sleeping.
While you're driving.
Yeah, while you're driving.
Yeah.
Or sleeping while you're driving. Don't do any of those things. We also have these are all very small percentages, but we have to speak on them. We do have some forehead skin redness here sometimes. This is again why we really, enforce that you have to really press that down. Make sure you wash with soap and water beforehand. Don't really do anything else other than that, and just take care of that electrode. The better you take care of it, if you ensure it's really pressed against your skin, that's gonna reduce the chances of any adverse events happening.
We also have the hypoallergenic electrodes. So if you know that your skin is a little delicate, I would definitely go for it. Like get the hypoallergenics. Then I don't know if I mentioned this before, but we have a special deal for whoever subscribes for our electrodes. You would say 5% plus free shipping, and you can set it up for 30, 60, or 90 days. So you don't have to remember getting your new electrodes. We'll do it for you, and we're gonna just ship them whenever you feel is convenient. We also have a question about the preventative treatment. I do 2 20 minutes treatment every morning, and again for a couple of hours if still bad. Is that okay? So if you're having a migraine attack, we recommend using the acute treatment, which is the longer treatment, the 60-minute treatment, which, we kind of call it the abortive treatment. So if you're having a migraine attack, use that, and 1 preventative treatment a day. I hope that helps.
Just elaborate on that a little bit more.
Thank you.
We don't know if we don't have any clinical studies to back up, how well it works using the preventative more than 20 minutes. Everything that we've said so far regarding the preventative treatment, it's done with that test of 20 minutes. So anything more than that, we can't, confidently say whether it's going to work or not because we haven't tested it.
And then we have, is CEFALY recommended for all types of migraine? So CEFALY is recommended. Our studies are for episodic migraine, but we do have customers and also ambassadors that use their CEFALY device and their CEFALY treatment, and they don't have episodic migraine, but they suffer with chronic migraine. Some of them have a hemiplegic migraine. Our studies are for episodic. But if you do have a specific type of migraine, let's say you have hemiplegic migraine, we recommend speaking to your doctor and ask your doctor first. But we do have testimonials and people that have had successful experiences using the CEFALY device, not necessarily with episodic migraine. So if you'd like to, I can send you guys a few testimonials. Maybe if you guys need more information regarding our, maybe you want to we can also put you in contact with our medical team. We're happy to do that too. Sorry, I can't talk today.
Also, just clarify episodic versus chronic migraine. An episodic migraine is 15 or less migraine days per month. And if you have greater than that, that would be considered a chronic migraine.
I have tension headaches and migraine spikes. Will these help for me?
Yeah, so we're indicated for migraines. So we can't confidently say or really say it all because we haven't clinically tested it. We don't have any actual hard evidence to support it. That's not to say it doesn't work. That's not to say it does work, but we cannot recommend it to you and say confidently that it's going to work for that. However, as Kiara said before, you could always talk to your doctor about that, and it's definitely not something dangerous. Just speak to them first.
Exactly. Also, we do offer a 90-day satisfaction guarantee. So if the device doesn't work for you guys, meaning that you don't see really the effects, you can return it, no questions asked. So I would definitely speak to your doctor and say, hey, I saw this great device on social media. Can I try it? And once you have the green light from your doctor, give it a try. Use TikTok 10 for a little discount. And again, if it doesn't work for you, you can return it within 90 days.
The nice thing about that 90-day period too is how I was speaking before. For you guys who just joined, the preventative treatment really, it works better the longer you do it, the more consistently you do it. So for those 90 days, that gives you enough time to see if it works for you. And if it doesn't, then you get your money back. So essentially very low risk.
Okay. Any other questions? Is it normal for CEFALY device to abort a migraine one time and not another? Oh, that's a good question.
That is a good question. That's a really good question. As far as I think the question is speaking on consistency, every single time is it going to do the same thing? That really depends on the person. Every single person has a slightly different experience with CEFALY because everyone's body reacts slightly differently. For some people, they can stabilize the treatment a couple minutes in, and others can take the full 14 minutes of ramping intensity and then carry that out the whole way. So for it to work every time, it's hard to say, because for some people it will, and for others it won't.
But one thing that we can tell you is that using CC as your migraine diary will help because you will understand your triggers. You will understand if there's trends in your migraine journey, and all that will help ease and possibly understand if there's anything in your routine that is contributing to your migraine attacks. So definitely use CC associated to your CEFALY device. So you can also download all the information and bring it to your doctor, or simply have it to your records. So yeah, but as Mike was saying, every person has a different migraine journey. So again, if the device doesn't work for you, we offer a 90-day satisfaction guarantee. The most important thing is doing your preventative treatment every day. That's what's gonna make the difference because that's what Mike just said. In our clinicals, they showed efficacy. So
Yeah, I'll also elaborate on that a little bit. For those of you who are just joining, I spoke a little bit about a test before, a clinical study where we did the preventative treatment, and it was a 90-day study. However, out of those 90 days, the patients didn't end up using it every single day. So all the numbers that I said, and I'll run through them again really quickly, we saw a quarter reduction, so 25% reduction in monthly migraine days, just in general, just overall in general. But for those people who saw a 50% reduction in their migraine days, they actually, 3 out of 4 of them didn't have to use any sort of medication. Like CEFALY was a viable replacement of medication for them. So yeah.
Which is what we aim for, like the beauty about having CEFALY in your migraine toolkit is that sometimes, when you're fighting migraine, sometimes you're also fighting with other invisible illnesses, and that will require taking other medications. So what we want you to do is, and what we want you to do is giving you the tools to feel empowered into using a device that will hopefully allow you to cut your medication. It is important to reach the highest level for effectiveness. I can only go 14% right now. No, that's a common misconception, I feel. You don't have to reach the highest intensity for the device to be effective. Start slow, start low, and little by little increase your intensity when you feel like you're ready. But again, the treatment should never be painful. It should be comfortable for you. So it's totally okay if 14% is your sweet spot. That's great that you know that. Maybe when you feel ready, go a little bit higher, but again, the treatment will still be effective.
Yep, your treatment should never be painful. Also, after 14 minutes, it's going to reach that maximum intensity. So after 14 minutes, it's just going to plateau, stay at that same level for the rest of the hour if you're doing acute, which would be the remaining 46 minutes. So it's great. You have the 14% right there. For those of you who do not use the CC app, you can also take a timer out on your phone and just keep track of the moment where you need to stabilize it for next time. But honestly, that is one of the great things about the CC app is, as Kiara has mentioned before, it lets you track everything, and not just your triggers or your tendencies, but it also lets you see exactly what percentage the intensity is at. So for you, to see that number, quantified in front of you, it makes it a lot less likely that you're going to do too much, or it makes it more likely that you're going to know exactly what your percentage is instead of, having to time it manually and do it that way. So
exactly. If I have nerve blocks and Botox, should I have a break from my CEFALY for a couple of days? Great question. So for Botox, there is no contraindication. If you're interested in CEFALY treatments and Botox injections, we recommend you discuss to your healthcare provider first. But if you already received Botox injection for chronic migraine, we recommend waiting 72 hours after injection before using your device. But if you're new to Botox and CEFALY treatments, we recommend starting one therapy at a time and waiting at least a few months before beginning another treatment. So if you're new to both, we recommend waiting in between the two treatments. But if you're not new, just wait 72 hours. And that.
Little fun fact, I guess, we actually started as a wrinkle reduction company. And we found through our testing that one of the effects of that was our patients were getting reduced migraines. And that kind of transitioned us into what we are today. So
exactly.
The more you know.
Hey, Mike, I know that you work closely with our veterans.
Mm-hmm.
Is there any successful story that you'd like to share with our community in the VA?
Yeah, there's actually a lot. A big part of my job is helping veterans, of course, and that's my favorite part of the job is calls like you were asking me about. I've had calls where I say, hey, they say, hey, my CEFALY treatment has made it so I can actually enjoy my day again. Or, they have a migraine at the beginning of it and I'm talking to them, walking them through it. And 20 minutes into the call, I'll start to notice they become more calm. They become happy and stuff like that. That's really the part of the job that makes it great for me is because, as you guys know, migraines are tough. And to have something and to be making a difference and helping with people's migraines, that's awesome. To actually hear the veterans say it or customers say it, whoever it may be. There's been so many times where I've just talked to people and they've told me how great it is, or I've helped them through something they weren't, comfortable with or knew how to do. And, that's the best part of this.
Agreed. Love that. We have another question. Hey, are your products available worldwide? Where are you located? We do ship in US, Canada, Europe, but let me know if you're located somewhere else. So maybe we have a distributor. I honestly am so grateful for my CEFALY. Thank you so much. We're happy to hear that.
We love hearing that.
And yeah, do you guys? I'm in Israel. That's
a good question.
I will get back to you on that. Could you please send us a message here on TikTok or simply on our Instagram, whatever you feel more comfortable. And I will ask our customer service department. I want to make sure I give you the right answer. But yeah, if you guys don't have any questions, yeah, I will. Thank you. Thank you so much for joining today and for listening to our clinical studies. Thank you, Mike, for
having me.
Sharing all your knowledge. And if you guys have any questions, you can always DM us. You can always send us a message on our chat. You can email us. You can give us a call. Or if you feel like you're not comfortable with your device yet because you need a little training, don't be shy. Book your CEFALY coach call. Go on our website, click on getting started, and then CEFALY coach. And then, one of our customer service representatives will help you with your device. So, alrighty. Thank you so much. And again, if you guys have any questions, feel free to reach out. Have a good one.
Thank you, guys.
Thank you.